Hello, my name is Sarah Thompson, and I am a third-year pharmacy student at the Benemedi Fish College of Pharmacy at UT Tyler. And today I'll be talking about digoxin with you. Digoxin is also known as Digitec, Lanoxin, or Digox, and it comes in oral solution, oral tablet, or IV. Digoxin can be used for a couple different things. So it can either be used for certain types of arrhythmias, like atrial fibrillation or atrial flutter, or it could be used for heart failure in adults. The way it works in atrial fibrillation or atrial flutter is it actually slows down the heart rate. And the way it works in heart failure is it increases the strength of contraction of heart muscles so that the heart can pump more blood throughout the body. So how to take this medication. For oral products, it's important to take digoxin at the same time every day and to keep taking this drug as your doctor prescribed, even if you feel well. For liquid medication, it is very important to measure the dose very carefully. So you want to use the measuring device that comes with the digoxin solution. If there is none, ask the pharmacist for a device to measure the drug. Something to note, low potassium or magnesium can actually lead to digoxin toxicity. So maybe you would like to talk to your doctor about incorporating potassium or magnesium in your diet or through supplementation. If you happen to miss a dose, take the missed dose as soon as you think about it. If it is close to the time for your next dose, skip the missed dose and continue taking the medication when you normally do. Do not take 2 doses at the same time or any extra doses. Some side effects that you should be aware of are signs of allergic reactions, so like hives, rash, or feeling like your throat is closing up, extreme dizziness or passing out, upset stomach or throwing up, diarrhea, changes in eyesight, seeing halos or bright colors around light, weight loss or not feeling hungry, a fast or slow heartbeat or abnormal heartbeat that is new or worse, hallucinations, mood or behavioral changes, feeling confused, if you have black, tarry, or bloody stools, throwing up blood or coffee ground like vomit, or enlarged breast. Some of these can be signs of digoxin toxicity, so it's very important to call your doctor right away if you notice any of these. Some things that you should tell your doctor before starting this medication. You should tell your doctor if you're allergic to this drug or any part of the drug, if you have any other heart problems, if you have had a recent heart attack. You should also tell your doctor or pharmacist about all the other medications you're taking, so that's prescription, over-the-counter, natural products, and vitamins. Tell your doctor or pharmacist about any other health problems that you may have. And do not start, stop, or change the dose of any drug without checking with your doctor first. This is very important because digoxin is a high alert medication, and if used incorrectly, may cause significant harm. So it's very important to inform your doctor or pharmacist about all health issues and medications, natural products, or vitamins that you're taking. Digoxin should be stored in a dry area at room temperature, protected from light and children and pets. Digoxin should not be stored in the bathroom, and do not flush it down the toilet or pour down the drain. All right, so to recap, I have a little quiz for you. Which of the following could cause digoxin toxicity if it is low? Is it A, calcium, B, sodium, C, potassium, or D, glucose? I'll give you a second. Okay. Great job. Yeah, so it is C, potassium. So low potassium, low magnesium, and high calcium may all cause digoxin toxicity. So it's very important to monitor those. Which of the following are possible side effects associated with digoxin? Is it A, mood or behavioral changes, B, new or worse abnormal heartbeat, C, weight loss or not feeling hungry, D, changes in eyesight, or E, all of the above? I'll give you a second. Okay, that's correct. Yeah, E, all of the above. So all of these are possible side effects that are associated with digoxin. And lastly, which of the following is important to tell your doctor or pharmacist before taking digoxin? Is it A, any existing health problems, B, other prescriptions or over-the-counter medications, C, if you're taking vitamins or natural products, D, stopping, starting, changing any medication, or E, all of the above? All right, that's correct. Yeah, so E, all of the above. Any of these you want to tell your doctor or pharmacist before taking digoxin. It's very important because digoxin can cause significant harm if there are any changes in therapy with any of your other medications. It can also interact with a lot of other medications and health issues. So it's very important to tell your doctor or pharmacist about all of these. All right, so I hope that was helpful. If you have any other questions, there is a link below the video that connects to the patient education pamphlet. If you have any more questions about digoxin, if that does not answer your questions about digoxin, do not hesitate to reach out to your doctor or pharmacist for any other questions or concerns that you may have.